Kenya's Senate is considering a reproductive healthcare bill which some say seeks to address reproductive health gaps. The bill includes, among other things, provisions for sex education in schools, assisted reproduction such as surrogacy, and access to safe abortion services when necessary. Now, the bill has drawn criticism from religious groups, politicians and civil society groups who say it goes against the fundamental right to life and encourages teen abortion. To help us understand this, I'm joined now by Nduta Waweru, who is a journalist in Kenya. Nduta, good evening and thank you very much for your time and joining us here on the news feed. Now, in 2010, this whole question of abortion threatened to collapse the whole entire review process of the Constitution. In 2014, this bill tried to be passed in Parliament and it failed. It is another attempt now in 2020. Have you done or have they done, let me rather ask it that way, broad consultation with the churches around this bill?
It is, as you've said, it's something that keeps coming up. And even at this time, they are complaining, that is the churches and the religious groups are complaining that they did not have enough information about the bill. And it is usually an excuse that comes up because it is not the first time this bill has been brought to the table. 2010, there was discussions on the same, and the questions about all the content, especially the abortion bit. And then in 2014, there was the discussion about assisted reproduction, that is including surrogacy, that is also abortion, and there is also sex education. And then today we have the same problems. It's a recurring thing, and I think them asking for, say, more time for consultation is actually just putting the head in the sand, because it will be an excuse that will be used over and over again.
What is the rate of acceptance of this bill in Kenya amongst the population?
Not quite sure about that, because it is very divided. Kenya sometimes seems very progressive, but when it comes to such emotive issues, the matters still go all the way to the basic details. A lot of people turn to religion, a lot of people turn to tradition, and eventually we get a higher percentage of the tradition, the conservationist, as compared to the progressive people. Yeah. And it's more rejected because also the information that is coming out connected to the bill is almost always negative, because now nobody talks about why we need to have safe motherhood. There is the discussion about access to information. If a woman within the reproductive age goes to the hospital and seeking sexual reproductive rights, what kind of information do they receive? Is there legal procedures, and is there laws to help foster that? A lot of people don't discuss that. They only discuss the things that they know it will capture the emotion of the people. This includes abortion, this includes surrogacy, because now apparently it is not the natural way to have children. There is also the issue of LGBTQ. There is also the issue that comprehensive sex education would mean teaching children to have sex. Yeah. So there is always that kind of information that goes around that makes more people reject the bill as compared to accepting it.
So, I mean, are those things contemplated in the bill? For example, the teaching of sex education to 10-year-olds. Is that what is contemplated in this bill?
The appropriate term is age-appropriate education. So depending with the age of the child, the kind of content, the kind of sexual education they will receive will not be way advanced or too little for them to understand, because that is exactly what is set in the bill. But for a lot of religious leaders, as they were complaining, they said it's a little bit ambiguous because they don't necessarily understand what exactly age-appropriate means and who is the one to determine the age of the children receiving whatever sexual education information they are going to receive.
Now, could this lead to political violence? I mean, as you mentioned, the type of division that is existing in communities, almost similar to the type we saw during the 2007 elections.
No, not really, because eventually it just captures whatever is going on in the country. For example, our maternal deaths are still very high. Just the other day, there was a woman who gave birth outside a hospital, the biggest maternity hospital in the country, because they could not let her come in. And the discussions about that were just so dismissive. It felt even disrespectful to that woman and her baby. But then it does not get to the point of the political upheaval that we usually receive around here. So basically, I don't think it will get to that position.
Now, current Kenyan law clearly, of course, outlaws abortion, except where a mother's life is in danger, the child's life, or rather the child could endanger the mother's life. And those are instances when it is allowed. What would the lobbyists and the activists want in terms of the choices that should be made available?
So the bill keeps the same content. It says when the mother's health or life is in danger and when there is need for emergency treatment. Those are the only two things that the new bill, as per our constitution, captures. But then the information that is going out there is that it is going to just allow abortion willy-nilly, which is also it's not true. Yeah. So a lot of activists are looking for ways these are the pro-abortion activists, or other people who are looking to promote SRHR. They're opening up. They want people to consider abortion as a health issue, not a morality issue, because that's the angle that we're looking at it from, that it is a morality issue. It is committing murder. So there is that kind of attachment to the word abortion. So it is an emotive issue. It brings all this division between the two opposing sides. Yeah.
What's the real threat then of the lawmakers being convinced or influenced by this false information as reported by Reuters, saying there's a spread of false information by churches and anti-abortion groups?
It depends. 2022 is our election year. So it depends with the sway of the country at that time. It depends with what the constituents want. And if the constituents at this particular time indicate that they do not want such a bill, chances are that it may not pass, because a lot of politicians would use it as a linchpin to be able to get back into office in 2022. So it cuts across so many things. The issue with the COVID, the issue with the economy downtime. What would you rather discuss? Well, would you rather discuss how we're going to bring up the economy, or would you rather discuss us having questions about abortion and things like that? So it's going to be a little bit tricky, but I'm hoping that they actually read the bill and they're able to understand what exactly it talks about.
Now, Nduta, you've already mentioned the question of maternal deaths. If this legislation is not passed, is not approved, what else will happen?
Definitely there would be increase in teenage pregnancies, because that is something we have been dealing with. And it has become even worse now that the schools were closed and children were at home. There have been so many cases about teen pregnancies. And the weird thing is that these teen pregnancies are from people close to the girls. These are parents, these are church elders, these are politicians. But nobody wants to have that particular discussion about who are impregnating the young girls and what are the circumstances of these teenage pregnancies. But they all want to say, no, the teenagers should not learn about the anatomy, they should not learn about sex, they should not learn about other things. And the other thing that we'd also see increasing is abortions. Chances of teenage pregnancies on the rise, and even unplanned pregnancies, especially during this time of COVID, that will definitely be something that might increase. In Kenya, we say about 2,600 women die of unsafe abortion. So that number would probably go up. Also, another thing is just the burden of lack of SRHR healthcare for women and girls across the country would also increase, which would also translate to all other things, developmental issues, economical issues. The money that would be used for handling maternal deaths would have been channeled to a different category if the bill would pass.